Welcome, Lode. Thank you very much for joining me today.
Thank you,
I want to start by talking about something that you were referring to earlier in your presentation, about the transactional experience that the patient will undergo. Do you feel like the patient now takes an almost business-like mindset into the doctor's office?
Oh, I think we're still far away from that. I only have to look to my parents and their generation. They still put very much the doctor on the pedestal. And I think doctors of that generation also look at that. They didn't look at it as a transaction. They more looked at it as a donation, which is almost like charity. You should be welcome. I'm giving you my knowledge. I'm giving you my treatment. So it was a very unbalanced relationship. I think it'll take some time, but I think we have to educate our children that as they have to also take more charge of their health, they will also become a real partner, and that really talks to transaction between two parties.
So as a partner, there's obviously give and take in most partnerships. Will you see a complete redefinition of that equation over the coming years? I
think we will in one way. The way I would like to summarize it is I think that we will all have to become the expert on our normality, and the doctor will become the expert on abnormality. What I mean with that is if you tell me that a certain thing, you have a blood pressure of a certain value, I will, to give that meaning as a doctor, I will compare it to population statistics. But you're not a population, you're Paul Sims, you're an individual. In the future, you will be self-tracking your own blood pressure and many other things of your life. And nobody but you will know whether a certain symptom is actually abnormal or normal to you. So you'll come to me actually with your symptom pattern compared to your normality, which has a lot more value than me just taking your, because I don't know how many hours you sleep, I know how much average. I know for that a lot of medical things, averages. You'll become the expert on normality. And then my task is when you give me that picture of what symptoms are, then I can make the diagnosis and give you the best treatment for you.
I think that sounds like a beautiful world to live in, where the patient can actually be informed to that degree. What I think that we almost suffer from in some cases in healthcare at the moment is that there are huge numbers of experts all around a big circle, and they don't always agree. And if the patient has an alternative opinion in terms of what makes them feel good to the doctor who traditionally we used to rely on almost to tell us what would be good for us, could you not see that sort of relationship actually causing more harm in some cases?
Wouldn't say harm, I would say healthy tension, but let's face it, most lamps just burn because there's a tension difference between both poles of the lamp. So some healthy tension is always good in every partnership because it keeps you on your edge. I think today already more and more we see patients who are seeking second opinions, and they're seeking our second opinions not necessarily from another doctor, but very frequently from another patient online or from another community online. And that's the reality of life. I mean, sometimes it's odd to see that when we want to buy something like a mobile phone or a camera, we spend actually more time looking around for information and finding the best provider and finding the best tool than we actually do for decisions that affect our health and our future health. So I think that it's actually that we're going to get to that same level and taking it serious. And maybe there will be some people who don't like the fact that somebody can have another opinion, but I think that's part of growing up.